Good evening and welcome to Nurse Maureen's Health Show podcast. I'm Maureen McGrath, registered nurse, nurse continence advisor, women's health advocate, and your host of this podcast. Tonight's episode is about one of the most heartbreaking stories in recent memory, the deaths of 3 young children in Duxbury, Massachusetts. Their mother, Lindsay Clancy, has become the focus of a highly publicized court case, with her defense arguing that she was suffering from postpartum psychosis at the time of the tragedy. As the legal proceedings continue, it's important to remember that the courts, not the media, will determine the facts of the case. Rather than discussing guilt or innocence, I'd like to focus on something that remains poorly understood even among healthcare professionals. That is postpartum psychosis. This is one of the few true psychiatric emergencies in medicine. Although rare, it can become life-threatening for both mother and baby if it is not recognized and treated immediately. So what is postpartum psychosis? It's a severe mental illness that usually develops suddenly within the first 2 weeks after childbirth, although it can occur any time during the first several months after delivery. It is completely different from the baby blues and much more severe than postpartum depression. It affects approximately 1 to 2 women out of every 1,000 births. While that makes it uncommon with millions of births every year, thousands of women and families worldwide experience postpartum psychosis annually. So what does psychosis actually mean? It means a person has lost contact with reality. The brain is no longer accurately interpreting what is real and what is not. A woman experiencing postpartum psychosis may hear voices that no one else can hear, see things that are not there, develop false beliefs known as delusions, become intensely suspicious or paranoid, believe her baby is in danger when there is no actual threat, believe she has a mission or a divine purpose. She may become confused, agitated, or behave in ways that seem completely out of character. To family members, the change is often dramatic. A mother who seemed well a day or two earlier may suddenly become confused, frightened, euphoric, or disconnected from reality. There's something else I want to talk to you about as well, and that is something called command hallucinations. This is one of the most frightening symptoms of psychosis, and as I said, it is called a command hallucination. It's when a hallucination commands you to do something. A hallucination is hearing or seeing something that isn't actually there. A command hallucination occurs when the voice tells the person to do something. These voices may sound like a stranger, someone they know, a religious figure, or even what feels like their own thoughts. To the person experiencing psychosis, the voices are completely and entirely real. Sometimes the voice may say frightening things like, "Your baby is suffering. You have to protect your child. Your family would be better off without you. You must do this. You must do this in order to protect your children." To someone who is psychotic, these commands are not recognized as symptoms of an illness. They may believe they are acting out of love, protection, or a higher purpose because the illness has profoundly altered their perception of reality. It is critically important to understand that not everyone with postpartum psychosis experiences command hallucinations, and not everyone who hears them acts on them. However, when voices are telling someone to harm themselves or another person or their children, known as filicide, it is a psychiatric emergency requiring immediate hospitalization. This is why healthcare providers must ask direct questions such as, are you hearing voices that other people cannot hear? Are the voices telling you to do anything? Do you believe someone is trying to harm you or your baby? Do you have thoughts that your baby would be better off without you? Now, it's my understanding that Lindsay Clancy allegedly had thoughts that she may harm her children, and she did tell that to loved ones. The questions that you ask as a healthcare provider are not meant to alarm mothers. That's why we need to normalize it. They are meant to identify a medical emergency before a tragedy like the Duxbury tragedy occurs again. Postpartum psychosis also is not postpartum depression. They are 2 very different things, but many people use these terms interchangeably, but they are entirely different conditions. The baby blues, something else, affects up to 80% of new mothers and usually resolve within 2 weeks. It may start on about day 2 or 3 for some women due to hormonal changes. Postpartum depression affects approximately 10 to 15% of mothers. Symptoms include persistent sadness, anxiety, loss of pleasure, guilt, not connecting with the baby, fatigue, sleep disturbances, and as I mentioned, difficulty bonding with your baby. Although serious, women with postpartum depression generally remain connected to reality. Postpartum psychosis, however, is rare and is characterized by hallucinations, delusions, severe confusion, disorganized thinking, mania, profound depression, or rapidly changing moods. It is a psychiatric emergency requiring immediate assessment and treatment. And I think this quite possibly was missed in the Lindsay Clancy case. So who is at greatest risk? The strongest known risk factor is a person with bipolar disorder. Women with bipolar disorder have an estimated 20 to 30% increased risk of developing postpartum psychosis after childbirth. Women who have previously experienced postpartum psychosis have a recurrence risk of more than 50% in future pregnancies if preventive treatment is not provided. Other risk factors include a previous episode of psychosis, a family history of bipolar disorder or psychosis, first pregnancy, severe sleep deprivation, which I understand Lindsay Clancy experienced. She was up for 48 hours at one time. And I like to say we are all 3 sleepless nights away from psychosis. Rapid hormonal changes after childbirth also can contribute to postpartum psychosis. And there are some warning signs that families and friends should never ignore. As family members are often the first to recognize something is wrong. And the warning signs include going several days without sleeping, talking rapidly or making little sense, extreme mood changes, severe anxiety or agitation, confusion, paranoia, believing the baby is possessed or is in danger, hearing voices, saying unusual or bizarre things, talking about death or believing the family would be better off without them. Something that Lindsay Clancy did that I read, she allegedly ran a 5K race about 5 days after she gave birth. That to me would be a sign of mania. But nonetheless, if any of the symptoms that I mentioned appear, seek emergency medical attention immediately and stay with the woman. Screening is so important. And one of the challenges is that screening tools commonly used in primary care, such as the Edinburgh Postnatal Depression Scale, are excellent for identifying depression, but do not reliably detect psychosis. Healthcare providers must also ask questions about hallucinations, delusions, confusion, severe insomnia, and rapidly changing behavior. Perhaps most importantly, many women experiencing postpartum psychosis do not realize they are ill. This lack of insight in itself is part of the illness. That is why partners, family members, friends, nurses, midwives, family physicians, nurse practitioners, and obstetric providers all play an essential role in recognizing the warning signs and ensuring the mother receives urgent psychiatric care. So the big question is, can postpartum psychosis be treated? Could this tragedy have been prevented? And the short answer is yes. Postpartum psychosis is definitely treatable, especially when recognized early. Treatment often includes immediate hospitalization, antipsychotic medication, also mood stabilizers, careful psychiatric assessment, and in some cases, electroconvulsive therapy, or ECT, one of the fastest and most effective treatments for severe postpartum psychosis. So I just want to mention that antipsychotics are a group of prescription medications used to treat mental health conditions, most often schizophrenia, bipolar disorder, and severe depression. They help to calm brain signals mainly by changing how the brain uses chemicals like dopamine and serotonin. And some of the first generation or the typical drugs are like haloperidol. They block dopamine, but they can often cause more muscle and movement side effects. Some of the second generations or atypical drugs are drugs like the newer ones, like risperidone and quetiapine. They target both dopamine and serotonin, usually with fewer movement issues, but a higher chance of weight gain. These are commonly used in schizophrenia to lower hallucinations, paranoia, and mixed up thoughts. They're also used in bipolar disorder to help to control those extreme mood shifts. They're also used in severe anxiety, which it does sound like Lindsay Clancy was experiencing. Also, the mood stabilizing medications are used to help manage the symptoms of bipolar disorder and other conditions characterized by significant mood shifts. And the most commonly known one is lithium, which is a naturally occurring mineral that is one of the most widely used and studied mood stabilizers. There's also some other medications that were developed to treat seizures that can also be used to stabilize mood, like lamotrigine or Lamictal, valproic acid or Depakote, carbamazepine or Tegretol. So there's lots of different medications available to help to treat this psychiatric emergency. And with appropriate treatment, most women recover fully. This was obviously a young woman, a young mother who loved her children. There were pictures of her with her children. There was one picture when she was pregnant with her second child, and her first child was on her abdomen, and she had her arms outstretched. There were many photos that I've seen online of a loving, doting mother. But we've heard the stories of her anxiety, her over-medication, also her multiple trips to the doctor, and also her expressing her fear that she was going to injure her children. The deaths of the Clancy children devastated an entire community and have also sparked an international conversation about maternal mental health. While the legal system will determine what happens in this specific case, whether she goes to prison or to a mental health facility, one thing is true. We need better education. We need better recognition of postpartum psychiatric illness. And I want to thank all those women online who have shared their stories, because this could have happened to anyone. We need better access to specialized maternal mental health services, and we need to remove the stigma that prevents mothers and families from seeking help. The overwhelming majority of women with postpartum mental health conditions never harm themselves or their children. Most women don't. Postpartum psychosis is exceptionally rare, but because its consequences can be catastrophic, early recognition is critical. If a new mother suddenly becomes confused, stops sleeping, appears disconnected from reality, hears voices, develops bizarre beliefs, or begins saying things that don't make sense, do not dismiss it as stress or exhaustion. Treat it in the same way you would chest pain or the symptoms of a stroke. We have to understand this is a medical emergency. Call for emergency medical help immediately. Better to be safe than sorry. Prompt treatment can save a mother's life, protect her babies, her children, and preserve an entire family's future. Thank you so much for tuning in to Nurse Maureen's Health Show this evening. I really appreciate it. If you found tonight's episode helpful, feel free to share it. The more we understand postpartum psychosis, the more likely we are to recognize it early, reduce stigma, and ensure that mothers receive the life-saving care that they need. Thank you.